Now, concerns are growing in Katsina State over the poor attitude of some healthcare workers in public hospitals across the state, especially with a recent development when a pregnant woman in labor lost her baby because of a lack of proper medical attention. The development has sparked public outrage because the woman in question was in prolonged labor after she was turned back from multiple public health facilities, which led to the loss of her baby. Arise News Katsina correspondent Awal Ibrahim tells us more.
Disquiet in Katsina over unprofessional attitude of healthcare workers towards their patients. This amateur video obtained by Arise News captured the moment when a heavily pregnant woman requiring urgent medical attention was left to her fate at the General Hospital, Katsina. 30-year-old Amina Sani from Abukur community in Rimi local government area was in active labor and was referred from Rimi General Hospital when her condition became too critical to be handled at the facility. But according to her husband, the arrival at the Ture Adwa Maternity and Children's Hospital in Katsina did not help the situation. The health workers on duty declined to admit the patient, citing lack of bed space. The family had to proceed to the General Hospital Katsina. There, the family ordeal continued. The hospital attendants didn't display any empathy, even with the condition of the pregnant woman getting more critical. They also declined to place her on admission, despite repeated appeals by family members and even other patients in the hospital. Even the doctor on call at the hospital, we gathered, didn't bother to show up for the patient. After every attempt at the General Hospital Katsina failed, the family was advised to seek help at the National Obstetrics Center, Babaraga, which is some 15 kilometers away. That meant a 15-kilometer journey on the very bad road for a patient in such critical condition.
After I told her that my patient is unconscious now, she said now she will not listen to us. That she told us that they don't have bed. Let us go anywhere we wish. I say, please and please, come out and take my patient to look for her condition. She said, no, they don't have bed. Let you just go anywhere you wish.
But they made the journey to Babaraga anyway at around 3 a.m. And it was at the National Obstetrics Center that the mother of two received the needed professional medical attention. But somehow it was too late. The baby couldn't make it alive.
One of the women we met there advised them to drop her own patient on the floor for me to use her bed space, but they objected.
Distraught Amina told our crew that her baby would have been alive today if not for the negligence and lack of care from those who should give it when it mattered most. She called for proper investigation and appropriate sanction against those found culpable.
They should be advised to be prompt in attending to emergencies.
So the federal government has given us that CMOC program where if a woman comes like that and she's indigent and she's an indigent of Nigeria, she's a Nigerian, so she will be offered emergency services free of charge. And then later, the federal government will now pay.
As for accountability grows, key players say addressing manpower gaps, enforcing discipline, improving patient-health worker relations are critical in addressing or restoring confidence on Katsina's public healthcare sector.
I think it is high time for the government to see maybe two to three possibilities. One is let there be practical sessions on behavior like a refresher course or refresher training, but not theory, practical sessions. And number two, let the government recruit something we call clinical instructors, even if it is short time for a year or for 6 months. Force them to these facilities.
Efforts by Arise News to speak to health authorities in Katsina State did not yield much results, as at the time of this report. Awal Ibrahim, Arise News Channel, Katsina.